Heart failure is a medical condition in which the heart is unable to pump enough blood to meet the body's needs. It does not mean the heart has stopped working. It means the heart is working, but no longer working well enough. To understand heart failure, we must first understand the role of the heart. The heart is a muscular organ that pumps blood throughout the body. This blood carries oxygen and nutrients to every organ, and it removes carbon dioxide and waste products for the body to function normally. This circulation must be strong and continuous. When the heart becomes unable to maintain this circulation, heart failure begins. There are two main types of heart failure. The first type is called systolic heart failure. In this form, the heart muscle becomes weak, the pumping chambers enlarge, the muscle fibers stretch, and the heart cannot contract with enough force. As a result, less blood is pushed out with each heartbeat. The second type is called diastolic heart failure. In this form, the heart muscle becomes stiff. It cannot relax properly between beats. It cannot fill adequately with blood. Even though contraction may appear normal, the total amount of blood pumped becomes insufficient. In both types, the final problem is the same. Too little blood reaches the organs, and pressure builds up inside the heart and blood vessels. This rising pressure forces fluid out of the circulation. Fluid then accumulates in the lungs, the legs, the feet, and the abdomen. This leads to the typical symptoms of heart failure. Shortness of breath occurs because fluid enters the lungs. Swelling occurs because fluid collects in the tissues. Fatigue occurs because muscles receive less oxygen. Rapid weight gain occurs because the body retains water. Many patients also experience coughing at night, difficulty lying flat, and frequent urination during sleep. Heart failure usually develops slowly over many years. It is most often caused by long-standing diseases that damage the heart. High blood pressure forces the heart to pump against strong resistance. Coronary artery disease reduces blood supply to heart muscle. Heart attacks permanently destroy part of the pumping tissue. Diabetes damages blood vessels and weakens cardiac function. Smoking accelerates arterial injury and reduces oxygen delivery. At first, the heart compensates. The muscle thickens. The chambers enlarge. The heartbeat becomes stronger. This compensation allows the body to function normally for a period of time. But compensation cannot continue forever. Gradually, the heart begins to fail. Early symptoms are mild. Patients may notice shortness of breath during exercise, reduced endurance, unusual tiredness. These early signs are often ignored. As the disease progresses, symptoms worsen. Breathing becomes difficult even at rest. Swelling becomes persistent. Sleep is disturbed. Daily activities become exhausting. In advanced stages, patients may experience confusion, poor appetite, and severe fluid retention. Heart failure affects more than just the heart. Reduced blood flow impairs kidney function. Lung congestion interferes with oxygen exchange. Liver congestion disrupts metabolism. Brain perfusion declines. This multi-system involvement explains why heart failure is a serious and life-threatening condition. Diagnosis is based on clinical examination and imaging tests. Echocardiography reveals chamber size, pumping strength, and valve function. Blood tests measure cardiac stress markers. Chest imaging shows lung congestion and heart enlargement. Treatment aims to reduce symptoms, improve function, and slow disease progression. Medications lower blood pressure, remove excess fluid, and reduce cardiac workload. Beta blockers protect heart muscle and stabilize rhythms. ACE inhibitors prevent harmful remodeling. In selected patients, implanted devices improve electrical coordination and prevent sudden death. Advanced cases may require mechanical support or heart transplantation. Prevention remains the most effective strategy. Controlling blood pressure protects heart muscle. Managing diabetes preserves vascular integrity. Avoiding tobacco prevents arterial injury. Regular exercise strengthens cardiac performance. Balanced nutrition reduces metabolic strain. Heart failure is a chronic condition, but with early diagnosis, proper treatment, and lifestyle modification, many patients live long and productive lives. The key is recognition. Persistent breathlessness, swelling of the legs, unexplained fatigue, reduced exercise capacity. These symptoms should never be ignored. Understanding heart failure allows early intervention, and early intervention saves lives. If this explanation improved your understanding, like this video, share it with someone who may benefit, and subscribe for more clear, science-based medical education, because informed persons make healthier choices.